Have you ever experienced a strange, persistent itch that won't go away despite using creams or lotions? What if this sensation, often trivialized or ignored, was in reality a subtle warning signal from your body, a cry for help indicating a much more serious underlying problem? In people over 60, persistent itching in specific areas of the body may be linked to hidden cancers, diseases that, in people over 60, persistent itching in specific areas of the body may be linked to hidden cancers, diseases that, if you tend to downplay this kind of discomfort by simply thinking of it as dry skin, stay with me. Today, we're going to explore 5 specific areas of the body where unexplained itching could be a warning sign of cancers like lymphoma, pancreatic cancer, certain breast cancers, or rarer cancers such as those of the anus or vulva. These are not randomly chosen areas. These locations have been documented repeatedly in patients who subsequently received a serious diagnosis. But be careful. The goal is not to panic, but to regain control. Identifying these early signals can significantly increase your chances of effective treatment. So, give me a few minutes of your attention, especially if you are 60, 70, or older. The itch you ignore could be what saves your life. Welcome to our channel dedicated to the often overlooked, yet crucial, health signals for older adults. Today we're talking about the subtle art of listening to your body through something as seemingly innocuous as an itch. For many seniors, obvious signs such as pain or lumps only appear later. The first signs are often subtle. A recurring itch, always in the same place, especially at night, can be your body's whisper before it starts screaming. Why is this important? As we age, we tend to blame everything on aging or dry skin. But some cancers, such as lymphomas, produce inflammatory substances that create strange symptoms, such as unexplained itching. For example, pancreatic cancer can cause obstruction of the bile ducts, leading to intense itching in the upper back. Here are the 5 areas of the body to watch for, and why itching in these areas can be a warning sign of cancer. 1. Persistent itching of the legs, especially the shins and calves. Often attributed to dry skin, they can actually be linked to blood cancers such as Hodgkin's lymphoma. This itching is deep, persistent, and often more intense at night. Example: George, 75, had been scratching his shins for months. After numerous trials of lotions and soaps, his doctor discovered an abnormal white blood cell count. The diagnosis: lymphoma. When to worry: itching without a visible rash, aggravation nocturne, accompanied by fatigue or night sweats, no relief with conventional care, to upper back or between the shoulder blades. This can be a sign of pancreatic cancer, especially if bile backs up into the bloodstream, causing a deep, inaccessible itch. Example: Linda, 60, felt a persistent itch between her shoulder blades. After a blood test revealed elevated liver enzymes, a pancreatic tumor was discovered. Associated signs: dark urine, light stools, unexplained fatigue. Treatment: resistant itch. 3. Itchy scalp without dandruff or redness. This may indicate a blood cancer such as leukemia or even skin cancer of the scalp, especially in people with thinning hair. Example: Henry, 65, suffered from an itchy scalp every afternoon. A blood test revealed chronic lymphocytic leukemia. Things to watch out for: tingling or burning sensation, unusual fatigue, constant itching in the same place, with no apparent cause. 4. Itchy chest or breasts, often associated with inflammatory forms of breast cancer or lymphomas. Men can also be affected. Example: Ruth, 69, felt a persistent itch under her right breast. After a medical examination, the onset of inflammatory breast cancer was detected, without a palpable mass. To observe: thickening of the skin, local heat, slight redness, itching that persists despite changing clothes or products. 5. Chronic itching of the anal or genital area. Often overlooked because they are embarrassing to talk about, they can nevertheless indicate anal, vulvar, or penile cancer. These cancers grow slowly and can start with a simple irritation. Example: Eugene, 76, thought he had hemorrhoids. In reality, a small anal cancer was the cause. Similarly, postmenopausal women should be alert to any persistent vulvar itching, which is a potential sign of cancer. Warning signs: itching without improvement despite good hygiene, burning sensation or deep irritation, skin changes, roughness, discoloration. Conclusion: should you worry about every itch? Number, but persistence, specific location, and lack of response to usual treatments are the key elements to monitor. Your body is like an alarm system. It sometimes sends discrete signals that you have to learn to recognize. Itching can be the first sign of a serious problem, long before pain or lumps appear. What you can do right now: observe the itchy areas, frequency, time of day, evolution. Note the associated symptoms: night sweats, fatigue, weight loss. Consult a professional if it lasts more than 2 to 3 weeks. Request a blood test or additional examinations. If you found this information useful, please subscribe to our channel and activate the bell so you don't miss any videos. Share this video with a loved one who frequently complains of unexplained itching. This simple action can change a life. Tell us in the comments: did any of these signs remind you of something about yourself or a loved one? Your story could help other people take their health seriously. Thank you for watching this video and taking care of your health. Stay alert, informed, and listen to your body.